Hello, everyone. Today we're talking about something that gets a lot of attention online, a lot of strong feelings, and unfortunately, a lot of misinformation. The topic is free birth. And before we go any further, I want to be very clear. This is not about shaming parents. This is about safety, science, and informed choice. Because you deserve facts, not fear, not fantasy, and definitely not Instagram algorithms deciding your medical care. Free birth is a term that gets used a lot online, and the problem is that it's often poorly defined on purpose. So let's slow this down and be very clear, because clarity matters when we're talking about people's lives. Free birth generally means choosing to give birth without any trained medical professional present. No obstetrician, no certified midwife, no nurse, no one whose job it is to recognize when normal stops being normal. And that's a crucial distinction because free birth is not the same thing as a planned home birth with a licensed midwife, even though the two are often lumped together on social media. A planned home birth with a qualified provider includes prenatal screening, risk assessment, medical training, equipment, medications, and, this part is key, an emergency transfer plan. Free birth does not. Free birth relies almost entirely on the belief that birth will go well because it usually does. And while that sounds comforting, it ignores a very uncomfortable truth. Childbirth can look completely normal right up until the moment it becomes life-threatening. Online, free birth is often framed using very appealing language. You'll hear words like undisturbed, instinctual, physiological, and empowering. You'll see beautiful photos, calm music, and stories where everything worked out just fine. What you don't see are the stories where things didn't go fine, because those stories don't go viral, and sometimes the people involved aren't here to tell them. As a doctor, I want to say this clearly and compassionately. Choosing free birth is not just choosing where you give birth. It is choosing to give birth without a safety net. It is choosing not to have someone present whose entire job is to notice subtle warning signs, changes in bleeding, heart tones, blood pressure, or fetal positioning that most people cannot detect on their own, no matter how prepared or intuitive they are. This conversation is not about intelligence, bravery, or love for your baby. People who choose free birth are not reckless or uncaring. Many are deeply motivated by past trauma, mistrust of the medical system, or a desire to feel in control of their bodies. Those feelings are valid, but feelings do not change physiology, and good intentions do not prevent emergencies. Words matter here because when free birth is presented as just another natural option, people may not fully understand what they're agreeing to give up. Trained observation, early intervention, and the ability to act quickly when seconds matter. In medicine, we don't plan for birth based on what usually happens. We plan for birth based on what can happen because when it goes wrong fast. Understanding what free birth actually is without romantic filters or fear-based messaging is the first step toward making a truly informed decision. An informed choice is the foundation of real empowerment. One of the most common things you'll hear in conversations about free birth is the phrase, birth is natural. And that's true, birth is natural. But here's the part that often gets left out. So are complications. Nature is not a guarantee of safety. Nature doesn't promise a good outcome. Nature simply means something happens without human intervention, and history is very clear about how that used to go. Before modern obstetrics, childbirth was one of the leading causes of death for women and babies. That wasn't because people were doing it wrong. It was because bodies, even healthy ones, don't always follow the plan. Birth can change from normal to life-threatening in minutes, sometimes seconds, without warning and without drama. No screaming alarms, no obvious signs, just subtle shifts that trained professionals are taught to recognize. Take bleeding, for example. Some bleeding after birth is expected. Everyone who gives birth bleeds. But the difference between normal bleeding and a hemorrhage isn't something most people can accurately judge in the moment, especially when adrenaline is high and emotions are overwhelming. By the time bleeding looks scary, the body may already be in crisis. That's not fear-mongering, that's physiology. Or consider oxygen deprivation in a newborn. A baby can appear quiet, pale, or slow to cry, and those seconds matter. Brain tissue is incredibly sensitive to oxygen loss. Waiting, hoping, or assuming things will resolve on their own can permanently change a child's life. These aren't rare, dramatic movie scenes. These are everyday emergencies that medical teams train for repeatedly because when they happen, you don't get a second chance. People often say, Women have been giving birth for thousands of years without doctors. And yes, they have. And for thousands of years, many women and babies died. Modern medicine didn't insert itself into birth out of arrogance. It stepped in because people begged for ways to survive it. Acknowledging risk doesn't mean birth is dangerous all the time. Most births go well, truly. But medicine isn't built around best-case scenarios. It's built around the understanding that when things go wrong, they escalate fast. And being prepared is the difference between a scare and a tragedy. There's also a misconception that risk equals failure, that if something goes wrong, it means the body was broken or the person didn't trust themselves enough. That mindset is harmful and deeply unfair. Bodies don't fail because someone lacked faith. They respond to stress, anatomy, genetics, and chance. Calling birth natural doesn't make it predictable. It doesn't make it safe by default. And it doesn't mean that refusing medical support somehow honors the process more. Respecting birth means respecting its power and its risks at the same time. Understanding that birth can be both beautiful and dangerous isn't pessimistic, it's realistic. And realism is what allows people to plan wisely, protect themselves, and give both parent and baby the best possible chance to come through birth healthy and alive. A phrase that comes up again and again in free birth spaces is, "My body knows what to do." And there is truth in that. The human body is capable of incredible, complex processes, and pregnancy and labor are not random events. But believing that the body knows how to give birth does not mean the body knows how to identify danger, especially when that danger is invisible, internal, or developing quietly. Your body does not have a built-in alarm system that tells you when your blood pressure is reaching stroke levels, or when an infection is beginning to spread, or when a baby's oxygen supply is slowly being compromised. Those are not things intuition can reliably detect. They require tools, measurements, and trained interpretation. Trusting your body and using medical knowledge are not opposites. They are meant to work together. One of the most dangerous myths surrounding childbirth is the idea that if you just listen closely enough, you'll know when something is wrong. The reality is that many obstetric emergencies don't announce themselves with pain or obvious distress. Preeclampsia, for example, can develop with few symptoms until it becomes severe. A person may feel off or have a mild headache or feel completely fine right up until a seizure or stroke occurs. The body doesn't warn you loudly because it doesn't know how. The same is true for babies. A fetus cannot tell you when oxygen levels are dropping or when the cord is compressed in a way that isn't immediately obvious. Changes in heart rate patterns, things that require continuous monitoring and experience to interpret, can be the only early signs that a baby is in trouble. Waiting until a baby is visibly distressed often means waiting too long. This is where medical training matters. Healthcare professionals aren't there because birth is broken. They're there because human perception has limits. We measure blood pressure because you can't feel hypertension. We monitor heart tones because you can't sense oxygen deprivation. We check temperatures because infection doesn't always feel like fever at first. These interventions don't replace the body's ability to labor. They support it by catching problems early. There's also a quiet pressure in some free birth communities that suggests needing help means you didn't trust yourself enough. That idea is not only wrong, it's cruel. Trusting your body does not mean refusing assistance. We trust our bodies when we wear seatbelts. We trust our bodies when we treat infections. We trust our bodies when we recognize that sometimes biology needs backup. Birth is not a test of faith or strength. It is not a moral achievement. It is a physiological event with variables that no amount of positive thinking can control. When people are told that intuition alone is enough, they may hesitate to seek help when something feels off, because they've been taught to doubt themselves or fear judgment. Your body is powerful, it is capable, and it is also human. Acknowledging the limits of intuition doesn't weaken empowerment, it strengthens it. Real confidence comes from knowing when to lean on expertise, not from believing you must do everything alone. When we talk honestly about free birth, we have to talk about outcomes, not just intentions. This is where the conversation often gets uncomfortable because no one wants to imagine harm coming to a parent or a baby. But avoiding the data doesn't make the risk disappear. It just makes people less prepared for it. Unattended births are associated with higher rates of preventable complications for both the birthing person and the newborn. This includes increased risks of severe bleeding after delivery, infections that go unnoticed until they are advanced, and newborn distress that requires immediate intervention. These are not rare, freak events. They are known complications of childbirth that medical teams train for precisely because they can happen even in low-risk pregnancies. One of the biggest dangers of free birth is delay. In obstetrics, timing is everything. A complication that is manageable when caught early can become catastrophic if help is called too late. Hemorrhage is a clear example. Postpartum bleeding can escalate quickly, and once blood loss reaches a certain point, the body may not recover even with emergency care. Having skilled providers present from the beginning dramatically reduces the risk because intervention happens before the situation spirals. For babies, the window is even smaller. Oxygen deprivation can cause irreversible brain injury in minutes. A baby who needs help breathing doesn't benefit from calm intentions or a peaceful environment if there's no one present who can provide effective resuscitation immediately. Calling emergency services after the fact often means the damage has already been done. Emergency medicine is powerful, but it cannot reverse prolonged lack of oxygen. There's also a misconception that if someone plans to call for help, if something goes wrong, that's enough. Unfortunately, many emergencies don't announce themselves clearly, and by the time it's obvious that something is wrong, valuable time has already been lost. Trained professionals don't just respond to emergencies, they prevent them by recognizing early warning signs that most people don't know to look for. Another important factor is that free birth outcomes are often underreported. When things go well, those stories are shared widely. When they don't, they may be framed as unavoidable tragedies or blamed on external factors rather than the absence of care. This creates a distorted picture of safety that doesn't reflect reality. None of this means that birth is inherently dangerous or that intervention is always necessary. It means that removing skilled observation increases risk, especially when something unexpected occurs. Safety in childbirth isn't about eliminating all risk. That's impossible. It's about reducing preventable harm. When people choose free birth, they are often doing so with the belief that avoiding medical involvement keeps them safer. The evidence shows the opposite. Support, monitoring, and rapid response save lives. And while no system is perfect, the presence of trained care consistently lowers the chance that a complication becomes a tragedy. Talking about these risks isn't about fear, it's about honesty. People deserve to know not just what might go right, but what can go wrong and how quickly that can happen, so they can make decisions that protect both themselves and their babies. A major reason people are drawn to free birth has very little to do with rejecting science and a lot to do with lived experience. Many individuals come to this choice after feeling unheard, dismissed, rushed, or traumatized by the medical system. Some have experienced unnecessary interventions, loss of autonomy, or providers who didn't explain what was happening to their bodies. That pain is real, and it deserves to be acknowledged without defensiveness. Medical trauma is not rare, especially in obstetrics. Birth is an intensely vulnerable experience, and when consent is not clear or communication is poor, the impact can last for years. For some, free birth feels like a way to reclaim control, to ensure that no one overrides their choices again. Wanting agency over your body is not radical, it's human. But avoiding medical care altogether is not the same as healing from a broken system. It's a reaction to harm, not a solution to it. The problem isn't that medicine exists, it's that it hasn't always listened well, especially to women, people of color, and marginalized communities. Walking away from all care doesn't fix those failures. It simply removes access to tools that can be life-saving when things don't go as planned. There's also a dangerous narrative that sometimes develops alongside this mistrust, the idea that doctors are the primary source of risk and that absence of care equals safety. This framing oversimplifies a complex reality. While unnecessary interventions can cause harm, so can the absence of timely intervention when it's truly needed. The answer isn't all medicine is bad or all intervention is good. The answer is appropriate care, informed consent, and respect. Another concern is that people who have been hurt by the system may be particularly vulnerable to online spaces that promise certainty and control. Social media can create echo chambers where fears are reinforced and opposing information is dismissed as propaganda or fear-mongering. In those spaces, questioning free birth practices can be framed as betrayal, and seeking medical help can feel like failure. That kind of pressure isolates people when they need support the most. The reality is that it should never be a choice between safety and autonomy. You should not have to risk your life to feel respected. Trauma-informed care, shared decision-making, and providers who listen are not luxuries. They are essential parts of ethical medicine. And while the system doesn't always deliver that consistently, abandoning care entirely places the burden of risk solely on the birthing person and the baby. Rebuilding trust in medicine takes time, accountability, and change from within the healthcare system. Patients advocating for themselves, asking questions, and setting boundaries are not problems. They are partners in care. The goal should be to improve how care is delivered, not to disappear from it. Choosing support does not mean surrendering control. It means demanding better care while still allowing professionals to do what they are trained to do: watch for danger, respond quickly, and help bring both parent and baby safely through birth. True empowerment in childbirth is often misunderstood. It's sometimes presented as doing everything on your own, rejecting outside input, or proving strength through endurance and isolation. But real empowerment doesn't come from going it alone. It comes from understanding your options, knowing the risks and benefits of each choice, and making decisions based on accurate information rather than fear, pressure, or ideology. Informed choice means having access to evidence-based information and being supported in using it. It means understanding not just what you want to happen during birth, but what you would want to happen if things don't go according to plan, because birth rarely follows a script. Empowerment is asking, what are my options if this changes? And having a team that respects your values while still prioritizing safety. There is a harmful myth that needing medical help during birth somehow diminishes the experience or means the body failed. That idea has no scientific basis and causes real emotional harm. Birth is not a performance, and it is not a measure of worth. A person who needs medication, monitoring, or surgical intervention has not done anything wrong. They have responded to reality. Empowerment also means recognizing that expertise has value. Just as we rely on trained professionals in emergencies, education, and infrastructure, relying on skilled care in childbirth is not weakness, it's wisdom. Trusting medical professionals does not require blind obedience. It requires dialogue, consent, and mutual respect. You can ask questions, you can say no, you can request explanations. Those are all parts of empowered care. Another key aspect of empowerment is preparation. This includes choosing a birth setting that matches your risk level, ensuring access to emergency care if needed, and surrounding yourself with people whose role is to support and protect you. Whether that looks like a hospital birth, a birth center, or a home birth with a licensed provider, the common thread is that someone trained is present to help when unpredictability shows up, as it often does. Empowerment also extends beyond the moment of birth. The outcomes matter. Being alive, being healthy, and having a healthy baby matter. A birth experience can be meaningful and beautiful, but it should never come at the cost of preventable harm. When empowerment is defined in a way that minimizes risk or discourages seeking help, it stops being empowering and starts being dangerous. Ultimately, empowerment is not about rejecting systems or proving independence. It's about advocating for yourself within them, pushing for better care, and making choices that reflect both your values and the reality of human biology. You are allowed to want a gentle birth and a safe birth at the same time. Those goals are not in conflict. Informed, supported decision-making is not fear-based, it's strength-based. And choosing care, support, and preparation is one of the most empowered decisions a person can make during childbirth. So here's the truth about free birth. It promises control, but often delivers risk. It's sold as empowerment, but removes safety. And it can turn preventable complications into irreversible outcomes. You deserve a birth experience that is safe, supported, and respectful. Your life matters. Your baby's life matters. And science is not your enemy. Thank you.